After a stroke or injury, the muscles remain intact, but the person loses voluntary control over them. This condition is called spasticity. It is a pathological increase in muscle tone, forcing the muscles to be excessively tense and resistant to voluntary relaxation. To restore control over weakened and spastic muscles, a targeted training is required. One of the effective rehabilitation methods is biofeedback therapy. Biofeedback is a method in which the patient learns to consciously control muscle activity by observing the body's responses in real time. We use biofeedback therapy in medical rehabilitation of patients after stroke and traumatic brain injury, as well as in peripheral nerve disorders, paresis, cerebral palsy, coordination impairments, and functional disorders. This Kolibri biofeedback system is a professional platform for assessment and training of the body's musculoskeletal system. The procedure begins with sensor placement and recording of biosignals. I customize the training according to the patient's specific goals, select the target muscles, adjust the workload level, and choose the training scenario. The patient immediately sees the results of the applied efforts in an interactive, game-based scenario. At the same time, I monitor the process and help prevent compensatory movements. This Kolibri system includes a library of pre-configured programs designed for common clinical tasks. If necessary, the clinician can fine-tune the training parameters for an individual patient or use ready-made scenarios. After the sessions, we analyze the dynamics over time and observe measurable patient progress. Biofeedback enables the patient to consciously participate in the recovery process, increasing engagement and adherence to therapy. For example, in post-stroke or post-traumatic rehabilitation, biofeedback training allows activation of the muscle even in cases of paresis. The patient sees on-screen feedback in response to attempts to move the limb, which encourages continued training. For continued training outside the clinic, a home-use version is available, Kolibri Biofeedback. Home-based sessions, as recommended by a physician, help maintain and reinforce rehabilitation outcomes.